transurethral resection of the prostate. This is part of a series of short videos to explain what an enlarged prostate, otherwise known as benign prostatic enlargement or BPE, is. This video highlights two very similar surgical procedures that may be suitable to treat your symptoms: transurethral resection of the prostate, or TURP, and the plasma TURP. Both procedures take up to 1 hour and are normally carried out under general anaesthetic, meaning you will be asleep during it. They can also be done using a spinal anaesthetic, meaning you will be awake and numb from the waist down. Patients usually stay in hospital for 1 to 3 days after the procedure. However, plasma TURP may have a slightly shorter stay or even be undertaken as a day case, with patients sent home with a catheter to be removed at a later date. In both procedures, a thin metal tube with a light, camera and loop of wire is passed through the urethra into the prostate. The loop of wire is heated with an electrical current and used to cut away enlarged areas of the prostate. This makes a wide cavity through the length of the prostate. As the small pieces of tissue are cut away, they are moved into your bladder. At the end of the procedure, this tissue is washed out of your bladder and sent to the lab to check for anything abnormal. Finally, a catheter is inserted into the urethra and a fluid is run through this into the bladder. It is then drained away to stop blood clots forming. Some bleeding during the procedures is common. During a TURP, your surgeon may use a separate heated device to cauterize or stop the bleeding. However, the plasma TURP usually has less bleeding, and so this may not be needed. In both procedures, the catheter stays in place for 1 to 2 days. This is because your urethra will be swollen and you may not be able to pass urine normally at first. It is common to feel tired for 1 to 2 weeks after the procedures. You should take things easy for 4 to 6 weeks and should avoid heavy lifting or straining. The long-term benefits of these procedures include long-lasting symptom improvement and improved urinary flow, no need for medication for enlarged prostate, and improved quality of life. Before the procedure, your clinician will talk to you about possible side effects. These include mild burning sensation when passing urine, increased frequency or urge to pass urine, blood in urine. Most side effects resolve within 4 to 6 weeks, but you should speak to your doctor if you have any concerns. It may take a number of months for symptoms to fully settle and improve. In both procedures, around 75% of patients will lose the ability to ejaculate semen. This is known as retrograde or dry ejaculation. It means semen is not ejaculated through the penis, but travels back into the bladder. It is not harmful, and sexual climax sensation remains, but it may feel different. Less than 1 in 10 patients having either procedure will have some loss of erectile function. This can be temporary or permanent, and medication can be prescribed to help. The main differences between the TURP and plasma TURP are: different frequencies of electrical current are used, there is likely to be less bleeding with the plasma procedure, the plasma TURP may have a slightly shorter length of hospital stay. Your urology surgeon will discuss possible treatment options, including side effects, with you, based on your own personal circumstances. More information is available online, such as these websites. Please discuss any concerns you may have about your symptoms with your doctor.